Welcome to another episode from the Veterinary Medicine Digest. Today we are conducting an extensive exploration into a groundbreaking frontier in veterinary medicine, which involves the objective quantification of chronic pain in our feline companions using advanced electroencephalography and a specialized algorithm known as pain identification and quantification. For many years, veterinarians and pet owners have struggled with the silent nature of feline suffering because cats are biological masters at masking discomfort, which often leads to underdiagnosis and inadequate treatment of conditions like osteoarthritis. We will begin by establishing the necessary background and context for this research by looking at the prevalence of these conditions and the current limitations in how we measure pain in clinical settings. Osteoarthritis is a chronic and progressive condition that affects approximately 25.6% of the adult feline population, and this incidence increases significantly as cats age. Interestingly, similar patterns are seen in other species, as research into young dogs has shown that radiographically visible osteoarthritis is remarkably common, even in animals aged between 8 months and 4 years. In the canine world, approximately 40 to 60% of young dogs with radiographic signs of joint disease also exhibit clinical pain. Yet these animals are frequently undertreated because their signs are subtle. In the feline world, the challenge is even greater because their behavioral expressions of chronic pain are intermittent and highly context-dependent. Many owners mistakenly attribute a decrease in activity or a change in mobility to normal aging rather than a medical condition that requires intervention. A significant study involving 206 mature cats between the ages of 7 and 10 years found that clinical abnormalities are incredibly common when thorough assessments are performed. This research revealed that 58% of cats had orthopedic abnormalities, 54% had dental disease, and 29% had heart murmurs. Despite these high numbers, owners often failed to associate physical changes like a matted hair coat or increased sleeping with the presence of underlying chronic pain. This discrepancy highlights a major gap in veterinary science, which is the lack of a rapid, reliable, and inexpensive diagnostic tool that can objectively reflect the actual painful experience of the animal. To address this gap, researchers have developed several clinical metrology instruments, most notably the Montreal instrument for cat arthritis testing for use by veterinarians. This validated tool allows clinicians to evaluate observable behavioral changes, body posture, and gait to provide an indirect estimate of pain severity. However, while these assessments are useful for detecting functional impairments, they are unable to evaluate the actual mechanisms of pain perception occurring at the level of the brain. This is where the integration of electroencephalography becomes a critical development in the field. Electroencephalography is a non-invasive diagnostic test that records the electrical activity of the superficial brain, including regions like the primary and secondary somatosensory cortices, which are directly involved in processing sensory information and pain. Historically, brain activity studies in cats were difficult to perform because they required implanted electrodes or heavy sedation, which could alter the very pain perception being studied. Recent advancements have now demonstrated the feasibility of using non-invasive surface electrodes in conscious, awake cats. By using a specially knitted wool hat to keep electrodes in place and employing positive reinforcement like treats and petting, researchers can now capture high-quality brain activity recordings without the need for anesthesia. The brain activity of individuals with chronic pain exhibits a distinct signature compared to healthy individuals. In humans, researchers have explored the use of positron emission tomography and magnetic resonance imaging to find these signatures, discovering that chronic pain is associated with sustained nociceptive inputs and changes in brain metabolism. In cats with osteoarthritis, positron emission tomography imaging has shown significantly increased metabolism in the secondary somatosensory cortex, the thalamus, and the periaqueductal gray matter. These changes suggest that chronic pain leads to neuroplasticity and the development of central sensitization, where the nervous system becomes hyper-responsive to stimuli. One of the most exciting developments in this area is the adaptation of a human-derived algorithm called pain identification and quantification for use in feline medicine. This algorithm was originally developed to decode pain-related cortical activity in humans by analyzing specific patterns in the electroencephalography power spectrum. The core premise of the algorithm is that the central nervous system pathways for pain are highly conserved across mammalian species, which allows for the potential transfer of diagnostic thresholds from humans to cats. In a recent proof-of-concept study, 5 adult cats were categorized into 3 groups based on clinical and neurophysiological evaluations, including those that were pain-free, those affected by osteoarthritis, and one with an ambiguous pain profile. These cats were evaluated using the Montreal instrument for cat arthritis testing for use by veterinarians and 2 types of quantitative sensory testing, known as the paw withdrawal threshold and the response to mechanical temporal summation. The paw withdrawal threshold measures peripheral sensitization by applying ascending pressure to the paw until the animal withdraws it, while the response to mechanical temporal summation evaluates spinal sensitization by applying repeated mechanical stimulations to see how quickly the animal reacts. The electroencephalography recordings for this study were acquired in both conscious resting states and under light sedation using a medication called dexmedetomidine. The researchers focused on recording activity from the somatosensory cortex using electrodes placed at specific locations on the scalp. The raw electrical signals were then pre-processed to remove noise from ocular movements and muscular activity before being filtered into standard frequency bands including delta between 1 and 4 Hz, theta between 4 and 8 Hz, alpha between 8 and 13 Hz, beta between 13 and 30 Hz, and gamma between 30 and 70 Hz. The pain identification and quantification algorithm specifically utilizes the gamma frequency band because these high-frequency oscillations are known to participate in the cortical integration of nociceptive information. To calculate the score, the algorithm applies a mathematical process called the Hilbert transform to the electroencephalography signals. This transform creates an analytical signal that reveals the nonlinear and non-stationary characteristics of neuronal activity, which is more effective than traditional methods like the Fourier transform. The algorithm then extracts the magnitude or the envelope of this signal and calculates the coefficient of variation within 1 second sliding windows. The final output is a percentage-based score where a threshold of 10% is used to indicate the presence of pain based on criteria established in human studies. In the proof-of-concept study, the results were striking. The cats that were clinically pain-free consistently showed gamma band scores of less than 10%. In contrast, the cats diagnosed with chronic osteoarthritic pain had scores that exceeded the 10% threshold in both their conscious and sedated conditions. Furthermore, the researchers found a strong negative correlation between the pain identification and quantification scores and the paw withdrawal threshold. This means that as the cat's physical sensitivity to pressure increased, their brain activity score also increased, which provides a direct link between physical manifestations of pain and cortical processing. Interestingly, there was a weaker association with the response to mechanical temporal summation, which primarily triggers spinal reflexes rather than the voluntary motor responses and sensor-motor integration reflected in the cortical recordings. The study also highlighted the nuances of measuring pain under sedation. In the cat with an ambiguous pain profile, the brain activity score exceeded the 10% threshold when the animal was awake but dropped below that threshold under sedation. This suggests that while chronic pain creates a persistent cortical signature that remains observable even when an animal is sedated, acute or subacute pain might be more responsive to the analgesic properties of sedative medications like dexmedetomidine. This discovery emphasizes the importance of performing these evaluations in awake animals whenever possible to avoid false negatives in cases of more recent or less established pain. The potential for this technology to transform veterinary practice is immense. Currently, chronic pain management relies heavily on owner perception and subjective behavioral scales, which can be influenced by the caregiver placebo effect, where owners see improvement simply because they expect the treatment to work. By providing an objective, non-invasive, and biologically based measure of pain, the pain identification and quantification algorithm could allow veterinarians to accurately diagnose osteoarthritis earlier, monitor the effectiveness of treatments like non-steroidal anti-inflammatory drugs more precisely, and ultimately improve the welfare of millions of feline patients. While these preliminary findings are based on a small cohort of cats, they represent a significant milestone in translational medicine. They demonstrate that human-based models for decoding pain can be successfully applied to other species without requiring modification, which supports the robustness of the underlying algorithm. Future research will focus on validating these results in larger and more diverse groups of cats and exploring the correlations between these brain activity signatures and factors like age and the specific duration of the pain condition. In conclusion, the journey toward truly understanding and quantifying the feline experience of pain has taken a giant leap forward. By listening to the electrical rhythms of the brain, we are finally moving past the limitations of subjective observation and toward a future where every cat can receive a personalized and objective assessment of their comfort. As we continue to refine these tools, we move closer to ensuring that the silent suffering of our pets becomes a thing of the past. Thank you for listening. The titles for the referenced papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.